The rise in cosmetic enhancements and the general pursuit of looking as young as we feel has been linked to everything from our fascination with celebrities to the popularity of social media to the selfie craze. Many people are driven to improve the way they look, and laser treatments are fast becoming one of the most popular ways to address a range of beauty concerns. Whether you want to minimize your lines and wrinkles, correct the effects of the sun, erase tattoos, or tighten slightly lax skin, there's a laser treatment option available for you. Before considering laser treatments, there are some basic guidelines you should keep in mind, and as with any cosmetic enhancement, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. Be sure to ask plenty of questions, including how much downtime to expect and what kind of lifestyle adjustments, if any, you might need to make afterwards. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one who is actually board certified in dermatology. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. Lasers can do wonders for the skin to reverse signs of damage, and despite other treatments you may be doing, it's important that you consider the best laser treatment for your concerns. There are two types of lasers available: non-ablative and ablative. Non-ablative lasers treat a host of concerns and are often less painful and require less downtime, but usually necessitate a series of treatments. These types of lasers penetrate the skin without compromising the outermost layer. Ablative lasers are used to treat more serious skin conditions like major sun damage, pigmentation, scarring, or even wrinkling. These lasers physically remove the top layer of the skin and are more aggressive and have a lengthier recovery time, but deliver the most dramatic results. If you're looking to get rid of unwanted hair, ND-YAG, diode and alexandrite lasers will do the trick. These lasers send a beam of pulsating energy to the skin, which is absorbed by melanin in the hair follicles to kill the base roots, stopping hair production. To treat pink and red pigments in your skin, ask your doctor to tell you about pulsed dye lasers, which help to lighten the problem areas by using pulsed dye energy to target pigment in the skin and make it more uniform in color. Although not technically a laser, intense pulsed light is a versatile treatment that improves skin texture, minimizes minor sun damage, and assists in hair removal. With this treatment, a beam of high-energy light is transmitted and absorbed by skin tissue to treat affected areas. To remove an unwanted tattoo, picosecond, Q-switched, alexandrite, and ND-YAG lasers may be a good option for you. These lasers hone in on the color in the tattoo, helping to lift the pigment up from the skin. Ask your doctor about erbium lasers if you're looking to lighten trouble spots on your skin. These lasers will help lighten pigmentation as well as diminish wrinkles and resurface your skin. If it's severe lines and wrinkles, sun damage, or traumatic scars you suffer from, fractional CO2 lasers might be right for you. These lasers create tiny wounds in the skin to help initiate new collagen and elastin production. Fractional resurfacing lasers will help to minimize mild wrinkles and discoloration on the face, hands, chest, and neck, as well as even out mild acne scars. These lasers work by safely damaging small areas of the skin to incite collagen production. Fractional resurfacing can be performed with a non-ablative or ablative laser. While they aren't technically lasers, other body treatments fall under the laser category because they rely on an alternate energy source, such as radiofrequency, cryolipolysis, and ultrasound-based treatments to address loose skin, prompt collagen production, and freeze fat cells. There are many laser procedure options available and new treatments being developed constantly, so it's important to do your research and educate yourself on some of the latest options available. A comprehensive exam and personalized consultation with your doctor will determine what is needed to achieve the best possible results for you. You'll find that the more you share with your doctor, the more likely you are to be pleased with the final results. Anticipating your results is the fun part, but it's important to understand potential complications, alternative options, recovery time, and regimen you may need to follow for post-treatment care set out by your doctor. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Once all of your options are discussed and your questions are answered, it's time to book your appointment.